Hi, folks. Canadian Prepper here. So, it's come to my attention that the Surgeon General of all people has said that you don't need to wear masks and that you need to save those masks for the health authorities and the government officials and the emergency services who need them. So, be warned, this is going to be a rant. If I ever did one, this is going to be one. Because this has to be the most asinine recommendation or suggestion that I have ever heard from a healthcare provider of all people. So let's start off with this assumption that you going down to the hardware store, to Home Depot, Rona, Canadian Tire, Walmart, and buying some N95 masks, that is going to have any consequence for hospitals or emergency services. I can tell you that it absolutely will not. The reason why is that they get their stuff directly from the distributors or the suppliers because they use a lot more of that stuff than could ever be found in a Home Depot, who may have maybe 100, 200, maybe 1,000 in every store, when in peacetime, when there is no pandemic, okay? And they're used mostly for industrial applications. They may have a small amount, but the amount of personal protective equipment, especially the disposable stuff that one hospital in a major city needs, is going to be in the thousands of masks a day. So there is no way, shape, or form that you going down to the hardware store and buying a mask has any negative effect on any public health care whatsoever. These people are not going down to Home Depot. The police, whatever, government, bureaucracy, emergency service is not utilizing these places for PPE. And if they are, they're scraping the bottom of the barrel, and it's going to buy them an extra 15 minutes of delivering, healthcare. Now, if things got as bad as they did in, China, then the shortages may get so bad that, that they're going to be short supplied. But even then, the small amount of that personal protective equipment that is warehoused in these, at the end level and the retail level is not nearly enough to provide, to make a dent, to make a difference whatsoever. So that idea is completely asinine. Guilting you for using that stuff is stupid. The only people who are actually going to be affected if you do hoard masks are going to be other people, other citizens who won't have access to that stuff. So I will say that if you come across, which is unlikely right now, but if you come across a big stash of N95 masks or N99 P100 particulate masks, the half-face respirators with the organic vapor cartridges, if you come across that stuff and there's lots of it, don't clean it out. Take what you feel you need, maybe a dozen, 24 masks, because they are disposable. If if we're talking about a long-term quarantine situation, then, you're going to need that many because they're not going to last long, especially if you're a person who's in the high risk population, like geriatric. If you're over the age of 60 and they're telling you to not wear a mask because you're taking from hospital care providers that might need it, the notion that they're telling people who are in a high risk population not to wear masks, to me, is borderline criminal. It's not borderline criminal. It should be criminal. And they should be legally liable for anybody who gets sick because they were told that they didn't wear a mask. Think about this. Wearing a mask, of course, it's not 100%, okay? We all know that N95, especially N95, only blocks out a certain amount of particulate matter down to 0.3 microns, not enough to actually block out the virus, but it will block out particles, which the virus piggybacks on. So you're much better off wearing a mask than not wearing a mask. You're much better off putting a rag over your face than not having anything at all. Yes, your eyes are going to be exposed because there's mucous membranes in there, but it's far more likely that you're going to get the infection through your respiratory tract by breathing in the droplets, if it is airborne, like they say, even though now they're probably going to say, oh, we're not really sure it's airborne, so you don't need a mask. But let's be honest. They've said it's droplet airborne from the start. Some people even speculate that it might be aerosolized airborne, although I don't, I'm not going to sit here and say that I've seen some definitive studies that say that. But regardless, a mask will absolutely help, even if it just prevents you from touching your face. As long as you properly dispose of it and take it off afterwards, it absolutely will help. It's like saying, I only have a spring coat or a fall coat, like a sweater, but I shouldn't wear that because it's not going to help me survive through the winter. If you were to go out in winter time and all you had was a sweater, if someone told you, don't wear that sweater because it's not enough to keep you from freezing to death, you'd be like, are you crazy? At least it's going to help me a little bit. At least I might be able to get a little bit farther. It's going to minimize the risk. It's just ridiculous, man, that I don't know who they think they're fooling, but unfortunately they're going to fool a lot of people, because here's what's going to happen. People are going to believe this, and there's going to be a new stigma, because the majority of people, guys, the overwhelming majority, when they hear something on the news, they just go with that. Okay, they don't want to think about this kind of stuff. The majority of people will just flat out tell you, I don't want to worry about that kind of thing. Okay, so if the media is saying don't wear a mask, and the Surgeon General comes on and says don't wear a mask, people are going to start to stigmatize those who do, as either being, oh, you don't know what you're doing, that doesn't do anything, without even thinking, why the hell would they make masks in the first place? I mean, why have any particular masks at all if they don't do anything? Why, all those guys, doing the asbestos removal, why do they don't need masks. They don't really do anything, right? All those people in the hospitals, they don't do anything, but they'll speak out of two sides of their mouth. They'll say, well, yeah, they actually do something. And the one article I was reading, it was so uninformed and misleading and dangerous, criminal. These people should be liable, because they're basically saying, oh yeah, well, N95 masks will prevent the spread if you're sick, but they won't actually protect you from the virus, which is completely backwards, because the N95 masks most come with a respirator, like a vent, which actually an exhalation valve. So that exhalation is not filtered. So you may, if you're sick and you're using an N95 mask with one of those exhalation valves, then you're potentially spreading the virus everywhere still. You would need some sort of antiviral face mask, which for some mysterious reason are not being sold anymore. We used to sell them here, but right when this pandemic came around, suddenly they were no longer being offered, which, I don't know, that's kind of strange. Maybe all of their inventory is being freed up for healthcare services. That's understandable, okay? And that's the thing there too, is that, let's say Home Depot gets sold out. Home Depot, Lowe's, Rona, Canadian Tire, Walmart, they all sell out of stuff. So they put in another order to the supplier for masks. What the supplier is going to do, they're going to prioritize the hospitals, the medical agencies, the government agencies. And I've talked to them because I buy stuff from those suppliers, and they've flat out told me that we have to prioritize this for the government. So the idea that you're somehow taking away from a medical care provider by protecting yourself, and this is where it really starts to piss me off, is that they're basically saying they're stigmatizing the protection of yourself. They're saying you shouldn't protect yourself because you're going to harm somebody else. That's a dangerous, dangerous line of thinking. And I can tell you it's absolutely not true. Like I said, the only way it's true is that you might be taking more than you need and taking from another private citizen. But you're in no way, shape, or form taking from the public sector. Okay, they have a direct line from the supplier. 3M is going to be pumping the hospitals. They're going to have a contract with the governments, and they're going to be making all kinds of money. And they have absolutely no problem limiting because they're only going to be able to produce so much, and the hospitals are going to need it. And I understand that they need it, but don't try to say that it doesn't do anything, and then say that, oh, there's a shortage of masks because the hospitals need them. That's complete and utter bullshit. Now you're going to have all these know-it-alls coming up to people, especially older people. Like Survival Lily made the video about the kids who were making fun of the older guy who was wearing the mask. Okay. And this guy is in a high risk population. He very well could contract this. And there's a 1 in 5 chance that he'll be hospitalized. Probably more if you're over that age, I'm assuming. And of course, there's a chance that he could die from it. So, you're going to sit there and laugh. And that's the world we live in nowadays. It's going to become a meme, a trendy thing to poke fun at people who wear masks, because these know-it-alls who know absolutely nothing about particulate filtration are going to suddenly, know everything there is about that topic. And of course, they're going to judge people, and people are going to feel judged, and they're not going to do it. And people are already self-conscious enough as is in Western society that they're probably not going to want to wear a mask anyways until it becomes the norm. See, in Asia, it's the norm to wear a mask anyways because of all the pollution. So it's not a big step to step that up to a medical mask, which actually can prevent pathogens. You would never know the difference. Of course, there are some companies who make more fashionable options, like the RZ mask. I'm sure they've sold right out. I did a review on their stuff a couple of years ago. But even that, you got to be careful with those. They work well for pollution, but because of the fact that you're dealing with viruses, means that the disposability doesn't work well with those cool looking ones that make you look like a superhero ninja, because you got to dispose of it, or you got to leave it out in the sun, or you got to expose it to high heat to kill whatever virus may be on the outside of it after you're done with it. Anyways, guys, I just think it's absolutely ridiculous. We do have some P3 filters coming in for 40 millimeter threads. They're going to have some pretty tight HEPA filtration in them, which is going to offer like 99.997% protection. So it's actually going to filter down to the virus level. They're currently back ordered, I think, for about a week, but we're supposed to be getting in the first shipment next week. And I think we have another shipment coming in 2 weeks. Now, I want to do a video on the different types of masks, when you're going to use the different types of masks, because there are many different layers of protection. So you have your N95s, you have your N99s, your P100s, your half-face respirators, your full-face respirators with dedicated virus particulate filters, which are the best that you can get. And then, of course, you step it up to a self-contained breathing apparatus, which is the ultimate in protection, which most people aren't really going to need. I mean, if we were talking about an Ebola type situation here, then yeah, you might want to step it up to that level. With this, unless it mutates, or unless maybe it's already mutated, I don't know, based on what's the statistics coming out of Iran and Italy, that there may be some indication there that maybe this is slightly more virulent than we initially thought, but that's yet to be seen. It's likely that, it's just the tip of the iceberg and you're not seeing all the mild cases. Regardless, we're going to do a video which deals specifically with the different levels of personal protective equipment and how it pertains to viruses. So stay tuned for that, but don't believe this hype about how you don't have to wear a mask and that you shouldn't wear a mask and that you're taking from other people who need it. This is absolute nonsense. Okay, the government has priority with these suppliers. This to me is concerning, not only because I feel that it's very irresponsible, especially for somebody so high up, like the highest of the high in terms of healthcare professionals, but it also makes me think that this is actually quite bad. And, are they trying to minimize the panic to slow down the economic recession which we're currently in? Or what would the true motive be? Because they know everything that I'm saying right now. They're not stupid. So what is the real motive behind telling people not to wear masks and stigmatizing the wearing of masks? There must be some purpose to that. Maybe it's just stupidity. It could very well just be that, the Surgeon General and these other people are not fact-checking or not, being logical for whatever reason. But I think this is probably bad, and they don't want to create any more of a panic than they need to. Maybe they're worried that people are really going to freak out about this, and it's going to lead to some social unrest, possibly, because we've already seen it. People are already lining up at Costco to get supplies, and I'm telling you guys, the clock is ticking, that if we start seeing this take more people down, and yeah, just stay alert and do what you feel is right for you. I'm not saying that you need to start wearing a mask everywhere, even though this thing is probably everywhere by now. To be honest, it's probably everywhere. I heard the statistic that if you see 20 deaths as a result of this, those 20 deaths are reflective of what existed maybe 20 days ago because of the incubation period, and the probably more than that, probably like a month ago, because of the length of the incubation period plus the symptomatic phase. Okay, add that up, it's about 30 days. So that means that those people have had it for 30 days. So 30 days ago, you had probably 1,000 people. So if you're only counting 1,000 now, like they are in Italy, roughly 1,500, 2,000, that means there's probably tens of thousands. Okay, that means that these numbers we're getting are just the tip of the iceberg. So that's why I think the numbers are utterly useless. This 87,000, just disregard it. It's probably a million. It's probably a million. And I'm not the only one who's saying that. You know, people who study this stuff for a living are saying that. But they can't officially say that. And you never really could officially say that. We'll never know how many, you know, what the true number is, because there's so many mild cases that don't get reported, but there's also a lot of people that are going to pass away, and they're going to pass away from flu-like complications, and they're never going to get recorded, as well as they probably were never recorded in Asia where this thing originated. So anyways, guys, wear your masks, and, you know, don't feel bad about it. Thanks for watching. Canadian Prepper out.